Medicine can be challenging, but Everyday Health Tutor helps make it simple. By turning your lectures and notes into personalized study plans with engaging videos, practice questions, and flashcards, learning becomes smarter and easier. Try it free today. Now, let's explore one of the most studied and impactful viruses in human health, Human Papillomavirus, or HPV. What is HPV? HPV refers to a group of non-enveloped DNA viruses that specifically infect human epithelial cells, the cells that line our skin and mucous membranes. There are over 100 types of HPV, each with its own preference for certain epithelial tissues. Some infect cutaneous epithelial cells of the skin, especially on the face, hands, and feet. Others target the mucous membranes of the respiratory tract, oral and nasal cavities, and the anal and genital regions. While many HPV types cause only benign growths or warts, others are oncogenic, meaning they can lead to cancers of epithelial origin, or carcinomas. Notably, HPV has been linked to throat cancer in actor Michael Douglas and cervical cancer in Argentina's former First Lady, Ava Perón. How HPV infects. Epithelial cells. Epithelial cells serve as the body's first line of defense, a barrier against pathogens and water loss. In regions like the skin, genitals, and respiratory tract, they are stratified, meaning they have multiple layers. At the base of this structure lie the basal cells, immature stem cells that continually divide to replace old or damaged cells. Normally, these basal cells are protected beneath the upper layers. However, when small abrasions or cuts occur, HPV can penetrate and infect the basal cells directly. Once inside, the virus may replicate independently or integrate its DNA into the host cell's genome. Two viral genes, E6 and E7, play critical roles here. They interfere with the host's tumor suppressor proteins. E6 targets TE53, E7 inactivates retinoblastoma protein, PRB. Together, they disrupt the normal regulation of cell growth and division, leading to uncontrolled epithelial cell replication. This dysregulation results in the formation of warts, lesions, and in high-risk cases, precancerous or malignant changes, cellular changes, and lesion formation. Under the microscope, HPV-infected epithelial cells often appear abnormal. A characteristic cell type, known as a koilocyte, displays an enlarged, dark-staining nucleus, irregular shape, and a clear area surrounding the nucleus, called a perinuclear halo. Koilocytes are hallmarks of precancerous epithelial lesions, which can progress to carcinomas if the abnormal cells invade deeper tissues beyond the basement membrane. Transmission and risk factors. HPV is primarily transmitted through direct contact with infected epithelial surfaces. This can occur via sexual contact, skin-to-skin contact, or childbirth when a baby passes through an infected birth canal. Certain factors increase susceptibility to infection or malignancy. Multiple or new sexual partners, compromised immunity, tobacco use, radiation exposure, and long-term immunosuppression. Symptoms and manifestations. Cutaneous infections, common warts, firm, rough bumps on the hands or nails, plantar warts, painful scaly growths on the soles of the feet. Flat warts, small, smooth, and flat-topped, often appearing on the face and limbs, especially in children. Filiform warts, thread-like projections on the face, particularly near the eyelids and lips. In rare cases, individuals with a genetic disorder known as epidermodysplasia, verruciformis, may experience persistent HPV infections that eventually evolve into skin cancer. Mucosal infections. In the respiratory tract, HPV can cause respiratory papillomatosis, leading to hoarseness and high-pitched breathing sounds when the larynx is affected. In the genital and anal regions, infections result in condylomata acuminata, also known as genital warts, which are typically skin-colored, soft, and cauliflower-shaped. While often painless, they can cause itching, burning, or localized bleeding. Low-risk versus high-risk HPV types. Low-risk HPV types, such as 6 and 11, cause laryngeal papillomatosis and genital warts, but rarely progress to cancer. High-risk types, particularly 16 and 18, are strongly associated with cervical, anal, penile, vulvar, and oropharyngeal cancers. These malignant transformations usually develop over years or decades. Diagnosis and testing. Visible warts are often sufficient for clinical diagnosis in cutaneous infections. However, mucosal infections may require more detailed evaluation. Endoscopy for respiratory involvement. Pap tests or acetic acid tests for cervical abnormalities. The definitive diagnosis of HPV, however, is made through molecular testing, identifying HPV DNA or RNA in tissue biopsies. Treatment and management focuses on removing visible warts and precancerous lesions. Topical agents like salicylic acid, cryotherapy with liquid nitrogen, laser therapy, or surgical excision. In recurrent infections, immune-modulating agents may help the body clear the virus naturally. Fortunately, most HPV infections resolve spontaneously, particularly in younger, healthy individuals. Prevention. Prevention remains the most effective approach against HPV. This includes HPV vaccination, ideally before first sexual contact, safe sexual practices, including condom use, and limiting exposure to infected individuals. Vaccines such as Gardasil provide protection against several high-risk HPV strains, including types 16 and 18. In summary, Human Papillomavirus, HPV, is a widespread DNA virus transmitted through direct contact that infects epithelial tissues. Its outcomes range from harmless warts to precancerous lesions and carcinomas. While many infections clear naturally, high-risk HPV types can cause serious malignancies if left unchecked. Early detection, preventive vaccination, and safe practices remain the cornerstones of control. Thank you for watching. If you found this video helpful, consider subscribing for clearer, concise explanations of medical and biological concepts. Learn smarter with Everyday Health Tutor.